Okay, do you ever look through your old photo albums and wish you looked like your younger self? Well, now you can through surgical facial rejuvenation. We welcome Dr. Edward Bednar from Bednar Cosmetic Surgery. Now, something I heard about you just before the show is that you're an artist as well?
Well, it's just not a marketing catchphrase. My practice, and for 25 years, we've always talked about the art of plastic surgery. So no, I paint and I carve and I sculpt. I've been doing that since I was 8 years old.
Wow.
And so that's a great aptitude to have. Here's some examples of some portraits that I've done.
Oh, that's a beautiful work.
And my grandfather's an American Indian, so I love the American Indian portraits. Very colorful, a lot of character. But in order to paint a portrait, you've got to really know and understand the topography of the face. And then it looks like the person that you're trying to portray. And it's the same thing with surgery. Once you get to a point where you really respect the topography of someone's face, you can really restore them to their natural kind of appearance and a more youthful appearance.
Yeah, the topography changes over time.
That's right, it does.
How do you use fat grafting to turn back the hands of time?
Well, what we do is we use everything in the facial rejuvenation process. That's just one tool, but I think that this is one of the most demanding tools to use. It really requires an aptitude to sculpting. And so from that aspect, what we're doing is we're combining it with a lot of the non-surgical procedures that we do. We're combining it with the facelift procedures. And I use somebody's photos when they were younger, and I'm saying, okay, how are we going to get to that point of rejuvenating them? And so fat is a way to do that. It restores the volume to the face because deflation occurs as you get older. Loose and lax skin occurs as you get older. And so we're trying to treat all of those things.
Okay, let's take a look at some before and after pictures now. Yeah, these are patients who you've used this procedure on?
Right, and these are my patients. This is before and after, and she is 60 years of age now, and you can see that the changes that occurred, a lot of loose and lax skin, and deflation. We call them compartments of the face. It's kind of like the middle third of your face deflates with time. So what we've done is reshaped and redraped, and from that aspect, this is a surgical side of that procedure, but she takes advantage of the other things that we offer non-surgically, of course, the Botox and the fillers and our Fraxel skin laser therapies. But all of these things in combination can be used to create a very nice natural appearance.
Now, would this work on an African-American woman, a Latin woman, all ethnicities?
It works on all ethnicities. Now, they age a little bit differently. In the African-American population and the Asian population, you'll see they don't get as much loose and lax skin, but they deflate, and they tend to deflate more. In fact, it's too bad, but I've got some examples in the office that show some really remarkable improvements when we use fat grafting in the African-American and the Asian population. It just reinflates the face and softens it back up.
Okay, now when someone comes in for a consultation, they bring the picture. Do you tell them the specific areas where you'll be taking the fat from and where you will be putting the fat?
Right. We go through a full consultation when we talk about all of the things that they're seeing, what their desires are. You really got to try and meet their expectations. Not everybody wants to come for a surgical procedure. A lot of them will come for the non-surgical side, but we can combine them all and we can use them all, and somewhere along your lifetime you may want to take advantage of the surgical side. So
I need to bring that glamour shot from 1985 with me.
It's better that we have candid shots, 10 to 20 years before. So that way I can really judge about the topography of someone's face.
Okay, thank you so much for that information. Now, if you call Dr. Bednar, you can get a free consultation. That number is 704-366-6700. That's 704-366-6700. And you've got some seminars coming up as well, right?
Seminar coming up on February 20th, and basically we'll talk with a lot about these modalities that we have to offer.
So that free seminar is coming up. Make sure you give Dr. Bednar a call.
Call the office. Make sure that you let them know you're coming, because we get some big attendance numbers sometimes at some of these seminars. We just want to make sure we can accommodate everybody.
Make sure you reserve your spot. Thank you, Dr. Bednar, for coming.
Thank you very much.